This case is from head and neck, and this patient presents with left-sided cervical swelling. And first I will browse the images so you can make an appropriate diagnosis. These are the axial post-contrast images of the patient. These are the coronal images of the same patient, moving from anterior to posterior. And these are the last set of images, which are the sagittal images, moving from right to left. Before starting discussing the case, I would like to discuss one image which is from the STAT-DX, and this is the tongue, and this is one of the muscle which is running from one side to the other, and this is the mylohyoid muscle, which basically separates two different spaces. This area which is above the mylohyoid muscle is known as sublingual space, and the space, this blue colored space which is below the mylohyoid muscle, is known as submandibular space. So basically, and one important thing is that anterior belly of digastric muscle is a part of the submandibular space, and the genoglossus and genohyoid muscles, these muscles are basically part of the sublingual space. And so in summary, the mylohyoid muscle is going to separate the sublingual space from the submandibular space. It is deficient posteriorly, so these two spaces continue with each other at the posterior aspect of the mylohyoid muscles. And there are also mylohyoid clefts seen sometime, which are defect in the muscles, and then the spaces can communicate directly through that defect as well. Now I will start reviewing the case in the axial images first. In the axial images, you can clearly see a large cystic area which is extending in the sublingual space, which is extending all the way posteriorly, and then it sort of communicates in the deep cervical regions in this area and extends up to the right sublingual region as well, and then it extends all the way inferiorly in this area. Now, keeping that image in mind, now I'm going to show you a coronal image of the patient. Now, if I bring the images at this level, now you can see that this part or this area of soft tissue is likely anterior belly of digastric muscle. And now if you follow this cystic area, it is extending below the genoglossus muscle and going to the other side, the right side. And now if you see this area, which is relatively a thinned soft tissue structure running from one side to the other, this appears more likely to be a mylohyoid muscle, which is relatively thinned out because of the significant pressure by the cystic area. And so this cystic area is predominantly confined within the sublingual space, and the main partition is this thin rim of the muscle which is separating the sublingual space from the submandibular space. Now, so in the sagittal images, you can appreciate that the lesion is predominantly confined within the sublingual space, although along the posterior aspect of the mylohyoid muscle, it is seen bulging into the submandibular space. And so it is not extending into the submandibular space through any cleft or defect of the mylohyoid muscle, but rather along the posterior aspect or the border of the mylohyoid and bulging into the submandibular space, and then further into the adjacent, causing adjacent soft tissue swelling. So a cystic area which is extending from the sublingual space into the submandibular space and is expanding with no aggressive feature is most likely suggestive of plunging ranula. These are basically the retention cysts which arise probably from sublingual or minor salivary gland regions, and they normally present with mass in the floor of mouth. There are two types. One is the simple ranula. The simple ranula is predominantly confined within the sublingual space, whereas then plunging ranula is also known as diving ranula, and it extends into the submandibular space, which can obviously communicate with the submandibular space through either a defect in the mylohyoid muscle or around the posterior edge of the mylohyoid muscle, which we have seen in this case. Other important thing is that they normally don't have any epithelial lining and they are more likely a pseudocyst type structure. And the average attenuation is normally around 10 to 20 Hounsfield unit. The word ranula is derived from the Latin word which means little frog, and you can just see that there is a bulging area in the lower neck region of the frog. This is a surface rendered image of the same patient which is showing a similar bulge in the neck and anterior cervical region, so from where the name was derived, as this also appears similar to the frog neck which was seen in the previous image. Thanks a lot for your listening, and I hope you enjoyed the case. Thank you.